So hello everybody, welcome back once again to the channel. I am very, very excited today to be joined by the one, the only Dr. Thomas Watchman of Zero to Finals. Show the camera fame. Which are,
thanks a lot, Ollie. Yeah,
I feel like approaching finals for all of us at the moment. Virtually everyone I know is using Zero to Finals. I don't think I know anyone who isn't. Tom, thanks so much for coming on.
Yeah, no, I'm very glad you invited me on. It's cool. It's great to be here, and it's cool to hear that people are using Zero to Finals.
I mean, there's kind of so much to unpack, I think, with the whole Zero to Finals project and the ethos behind it and so on, and the permeation and the success that you've achieved with the platform. So I guess, and just because it'll answer some of the many questions that were sent in by viewers out there, would you just be able to take us just very quickly, clinically, through your journey, how you came to be where you are, what you do day to day clinically, and then we can drill down into Zero to Finals?
Yeah, sure. So I guess in a way, I'm a GP. So I qualified as a GP in August last year. So at the minute, I work 2 days a week as a GP, and then I guess because of some of the success from Zero to Finals, I'm able to work 5 days a week on Zero to Finals. So I work 7 days a week, but 5 of those days don't really feel like work. They're just me having fun, kind of doing what I love to do, really. I guess I started medical school in 2008, graduated in 2014. Yeah, 2014. Yeah. Did foundation training, then took a year off as a locum, and that's when I started really creating stuff for Zero to Finals. And then did 3 years of GP training and then qualified as a GP. So I don't know if that hopefully answers your question.
Well, now here we are. I suppose there are just some questions that jump up from that, which are med ed. So obviously has been a central issue for you, and GP. Was GP always the goal?
I think med ed was always the goal. I actually wanted to be a teacher when I was in school. I thought I'll aim for medicine, and then hopefully that will kind of set me up well and give me a good enough sort of CV to get into university and stuff. And if I don't get into medicine, I'll become a teacher.
Yeah.
So education was something I really liked the whole time, basically. Even in school, I used to try and teach the younger years as much as I could. And then I went through medical school and kind of got indoctrinated with this idea of you just do medicine, and if you want to be a GP is kind of like that's the backup option. That's the option for people who want to have a work-life balance.
Yeah. Or
they're not really that ambitious, or they're not really that clever, and they kind of fall back on GP, and it's what most people do. So being a typical kind of ambitious medical student, I thought, I'll go into medicine. I quite liked endocrinology. I liked the hormones and the different axes and all these things, how it works.
Gross.
You're not a big fan. I quite like that, so I thought, I'll do medicine, become a physician, maybe an endocrinologist. And I kind of carried that through to F1, and then F1 was pretty challenging. And mostly just trying to balance all the other things that I wanted to do in life with working crazy hours as a doctor and night shifts and all the things that you do. And then actually it was my first job of F2 where I went into general practice, and suddenly my eyes were opened, because I guess like you, Ollie, I've always been interested in lots of different things. And suddenly in general practice, I was meeting GPs who were doing lots of different things, as opposed to in the hospital, where I was just meeting doctors who basically worked all the time and then went home and they had a family life and friends and things, but they weren't doing all these other projects on the side. And these GPs were all had a hand in the CCG or business, or they were setting up educational things. And it really inspired me that general practice looks like a great opportunity. And from there, my reasons for doing GP have just sort of piled up, really. I could talk for hours about it.
I mean, it's really, it is at least certainly consistent with what I've heard about GP, because until maybe last year, so my third penultimate year of medical school, you didn't really hear about doctors with as you say, like portfolio careers as such. As you say, people doing not, medicine might be a 9 to 5 or whatever, but you also do teaching or business or entrepreneurship or whatever you want to do. I still feel as though it's only really GP where I regularly hear about the value of a portfolio career. I think, certainly for people who want that richness, as you say, and it certainly sounds like you've achieved a lot of richness in your life, that GP is a really good option.
Absolutely. And I think, you can definitely get that in other specialties. I think a lot of the doctors I found most interesting, or the consultants I found most interesting in medical school, had various things that were happening, whether they were involved in the medical school as well as their clinical work, or whether they did something on the side part-time, or whether they had some other sort of aspect of their clinical management or their research or whatever. I was always most interested in people who had a lot of different things going on at once, rather than just I come into work and do the job and then go home.
Yeah, and I mean that's. I think that will become a theme of the conversation later when I maybe ask you some more focused questions about 0 to finals and touch on how I've been using it, as we are, as of today, 2 weeks out from our own medical finals. So as of now, 0 to finals, the 0 to finals empire, if you like, is we have these 3 books: medicine, pediatrics, and obs and gynae. There's the oh so wonderful flashcards, which have been getting me through revision day to day. But beyond that, there's the YouTube channel, there's the website. You've really built this whole plethora network of resources. So just at the beginning, how did you start?
This wasn't the aim from the beginning. I think probably the same with your YouTube channel or any project that you start, where you start to build something. You kind of got to start somewhere, and then it's only really through doing the work and thinking about it day in, day out, and evolving the things that you're creating, that you start to build things out. So the flashcards, I only had the idea for the flashcards about August last year. Before that, they weren't even on my radar. Although I do remember in medical school, flashcards for anatomy were the only way I could learn anatomy. And it was kind of translating that into how can I use that principle to learn all the key facts that are in the medicine book that you need for medical school finals. It basically started out just me and my locum year. I was desperate to create some resources for medical school finals, mainly because when I sat finals, I thought there's nothing here. There's no one resource that I can use to cover everything. And there were different resources that were really good. I remember at the time there was a Ask Dr. Clark, which I don't know if you've heard of that, but it's a course and they give you a book, and that has a kind of bare bones structure to what you need to know. And then for my finals, I supplemented that with other online resources like Almost a Doctor at the time. OSCE Stop was really good. And then like where there were gaps, I would create my own brief notes in a kind of similar way. And then I had this big folder of all the stuff that I use for finals. And I thought this could really be I could start from scratch and create like sort of the ultimate guide where you can just start from 0 and get to finals. And that was the idea of it. And that's kind of how the name came about. So the way I started that, I had about 4 months off after Foundation Year 2 training and just sat in the university library. I was doing a master's in medical education at the time, so I had access to the university library and just sat there and made some bare bones notes that I put on a website, and nobody used them. I maybe got 1 or 2 visitors a day for a couple of years, so nobody used them. And then over time it just grew and grew, and I could probably talk for about half an hour about all the different stages I went through, but each time you get past one idea and something else comes to mind, and you think, oh, what if I just read these out as a podcast and put them out into the world? And so I did that, and then turns out people really liked that. And then I thought, well, I always like making videos. So I tried to figure out what's the best way I can give this information across in a video format, and kind of it's quite established now how I make them. And then each step you just build on it. So that's essentially how it came about in a long-winded way.
Well, I mean, it's achieved so much. I mean, it doesn't sound, from what you've said, like it's actually been around that long. You know, in the grand scheme of things. I mean, I can see the silver YouTube plaque on the wall, obviously behind you.
Yeah. Yeah.
That's, you know, that level of reach, I suppose, and that level of recognition that people are finding this so useful is really something special, especially in a field like med ed, where certainly when I've been dipping my toes into things like med ed research in the last couple of years, med ed is still a little bit counterculture. I feel like a lot of the time it's seen as a very soft science, and, you know, what's the phrase? People that can't do teach, and people that can't teach do med ed. Like, is the you know?
Because I've not heard that before.
I've been told many times, but it speaks to your, I think, passion and drive, and despite all that, actually, it's still very personal. You know, in a way, you can. If I look at something like any of these books or any of these flashcards, I, to an extent, feel like I'm not dealing with a corporation. I'm not dealing with a faceless entity. I'm dealing with someone who wanted just to make the best thing they could and get it out there, and that's pretty rare, I think.
I think I put Zero to Finals success completely down to that, actually. I've been talking to a few different people about this same thing recently. I was actually talking yesterday to the owner of the company that prints the flashcards. He's called Jeff, and I was asking him, should we try and get these flashcards into like bookstores and things like that? And he was saying, in his experience of doing business for a long time, as soon as you start to try and get into the corporate world of things, everything becomes kind of watered down, or you lose control, and then it becomes about the money and like trying to make the most money and not trying to, you know, do what your initial vision was. And my vision was also always completely 100% focused on how can I make the best resources to learn medicine. It was nothing to do with, you know, how can I make the flashiest resource, or how can I get it accredited by different, you know, royal colleges so that, you know, it boosts my ego, or how can I make the most money, or how can I get published by a prestigious publishing house. It was nothing to do with that. And that drove a lot of the decisions for the book. At one stage I was thinking, I've got to really reference this really perfectly in the same way that they teach you at university. And then I thought, do you know, that's going to kind of slow me down, and it might make it too formal. And actually, I don't think students care about the references, as long as you give an idea, you know, this is from the NICE guidelines, this is from this place. And I'm convinced that because it's purely focused on how can I put the information on the paper so that students can immediately start learning and preparing for their exams rather than anything else, that's what's led to its success. And everything about it, I mean, as soon as you open the book, you realise there's nothing like flashy about it. There's nothing to like make it look very clever or anything like that. It's purely just a learning resource.
Yep. And it's pretty, you know...
straight to the point.
Well, as you say, basic, yeah, and then like page 3, what was straight in after a lovely dedication to Merrily, of course.
Yeah, that's my wife. Yeah.
That was one of the most common questions.
Oh, who's Merrily?
Yes.
Yeah, Merrily's my wife.
All
Yeah,
this
yeah.
stuff.
She wants all the books dedicated to her, but I want to spread around the love a little bit.
Treating me. Don't dedicate all your books.
Well, they would all. I mean, I dedicated the flashcards to her as well.
Yes,
I would dedicate all the
yes.
books to her, but it's worth spreading it around, I think.
Tom, certainly speaking to my peers, and my exposure to 0 to finals was only approaching our own finals, because I don't think people who aren't at medical school understand this commonly, but medical schools around the country obviously do not all assess the same things. You know, I go to Warwick, someone who goes to Nottingham or to Glasgow or to Oxford, despite the fact that we're all studying medicine, our exams and the things we are taught will all look very, very different. How is it, therefore, that when you're thinking about 0 to finals, how do you decide essentially what you're going to keep in? How do you try and separate the wheat from the chaff, as it were? How do you design your scope?
That's a tricky one, to be honest with you. My aim with 0 to finals is to put everything there that you need for medical school. And I'm not sure how different they are in the big scheme of things. I think they still want you to come out the other end knowing the core stuff. And interestingly, I think that you sort of realise what you're supposed to know once you become a doctor, and going through the process of medical training after medical school, you realise what's really important and what you need to know, especially seeing as I've done a few different postgraduate exams, like the GP exams, the MRCP exams, the Diploma in Child Health, and the Diploma from the Royal College of Obstetricians and Gynecologists. You start to see the same themes coming up again and again. And I think the answer is, ultimately, what I keep in 0 to finals is the stuff that is probably going to come up in medical exams. You need to know for clinical practice, and is tested in most of the postgraduate exams. And I'm not sure there's too much I need to leave out, really, once you cover all of those things. I don't think there's too many gaps in there. I think you could probably do MRCP with the medicine book. You could do the Diploma in Child Health with the PEDS book, and the Royal College of Obstetrician and Gynecologist one you could do with the Obs and Gynae book. So they've got enough stuff to even get you through postgraduate exams. I'm fairly convinced of that, having done them with essentially the same knowledge. And it's the same... Yeah, and it's the same stuff you need for finals. And if you start learning the content of the 0 to finals books or the 0 to finals content on the website, which is free, you could start learning that in first year, and it would set you up for the rest of medical school. And also give you some context about what you're learning in the first year when you're learning stuff that you just think, why is this relevant? Yeah.
Well, that's going to be my follow-up question, right? And when we were chatting just before filming just now, what certainly what I've become a lot more cognizant of is that medical school exams seem to be about a mixture of two things, and those two things are obviously common clinical important stuff that you're going to see day to day, and we're, fingers crossed, all going to use as junior doctors. But there is a certain amount of very ethereal, abstract, just strange rote learning that you purely need to learn because someone at some point decided that this obscure thing should be on the medical curriculum but has no sort of real world application. I mean, this is more, you're obviously very experienced in med ed. Do you think the current state of medical exams reflects real world practice very well? Do you think we'll see change?
It's a curious one, actually. that's quite a deep question, and I don't know how much I've thought about this. I think it's tricky. I think about this a lot in terms of these strange questions that you get. For example, today I was writing the section on renal cell carcinoma for the surgery book, and I don't know how many times in my career I'm going to see renal cell carcinoma. And one of the Tom tips was about cannonball metastases, which are a common exam question. A chest x-ray shows all these big circular lesions. What's the primary? And you need to know it's renal cell carcinoma. And interestingly, I've come across this idea of cannonball metastases a couple of times in my career, just people showing me x-rays and stuff. But I don't think I've ever seen a patient myself, and I don't think I've ever seen a patient and diagnosed them with renal cell carcinoma. I've seen them, followed up in GP when they're having treatment and so on. So you think, well, do I need to know that? If I'd have become a hospital doctor, maybe I would have come across it acutely. As a GP, maybe I would send somebody on a 2-week wait and it'll turn out that they've got that. But how much do I really need to know that? It's a curious question. I don't think it's going to change, because if they just test you in medical school exams on the really common stuff that you're going to see day in, day out, everyone's just going to know it, and it's going to be too easy. So there is an element of them making medical school exams complicated enough to really test you and make sure that you put in the work. The other question, which is kind of curious, I find, and I think about quite a lot, is in medical school, the pass rate, the pass grade for medical school exams is often like 50% or 55%, some ridiculous low number. And in my, job as a GP, let's say I got 50% or 40% of the people I managed, I got them completely wrong. It would be pretty bad if I missed like 40% of cancers or 40% of serious infections or septic people. It would be really bad. So there's this curious thing of like, I passed my MRCP exam grades to show that I'm really clever physician, but I only passed it with 60% or 70%, or that's the pass grade. But yet when I'm actually practicing medicine, people have that expectation of me being 100% right all the time. And you see news stories about doctors who've missed diagnoses and bad things have happened. And society and, the family and everybody kind of acts as though they're some horrible criminal because they've missed this one thing in their 20-year career. When the medical school exams that they sat, they were only getting 60%. It's a very strange situation. But I don't know what the answer is to that. I haven't thought it through hard enough, I think.
Well, see, there's also that there is a strange dichotomy there, isn't there, about because in GP, and this is a very broad generalization, but one would assume that statistically as a GP, you are seeing the things that are common and curable rather than these very, very rare, strange rheumatic conditions that would never be managed in primary care anyway, and obviously would be led by specialists. But those are the things that are tested in medical school exams for whatever reason. As you say, yeah, you could almost get all of the very obscure textbooky things absolutely right, never see any of them in your career, and get all of the common stuff wrong, but still graduate medical school or become a GP or do all the other things just by a roll of the dice.
But having said that, what is the role of a GP? I mean, he has to treat some common things, treat tonsillitis and spot these common conditions. But actually, a big part of what a GP does is like trying to figure out when something weird is going on, when something doesn't quite fit, and know where to send people. And I would say as a GP, there's usually, I'll see 32 I'll have 32 appointments in a day's work, and a lot of those, they'll be straightforward things. At the minute, a lot of mental health stuff, but there's also usually sort of like 3 or 4 patients during a day where I think, whoa, I got to really get my thinking hat on here, because something is going on. And you may think, oh, I think this is a bowel problem. Maybe this person has got inflammatory bowel disease or bowel cancer or something because of their abdominal pain, and you send them off to see a bowel specialist. And the specialist kind of says, well, does it fit into the 6 boxes of conditions that I manage? No, it doesn't. Go back to your GP.
Yeah,
I've excluded my problems. And then as a GP, then you have to get your thinking cap on again and say, well, could this be an upper GI problem or a gynae problem or some other thing going on, musculoskeletal problem or a neurological problem, or could it be just psychological? Can we exclude serious causes? So I think as a GP, because you're a generalist, actually you're the one who kind of needs to know about all of these weird and wonderful situations. And the common stuff becomes quite straightforward after a while. It's straightforward. Somebody's got a fungal nail infection, you know how to manage it. But it's those weird situations where you think, well, I'm not really sure what's going on here. I need to think hard. And we don't have the luxury of being like, well, it's not our specialty, discharged.
No. And it genuinely is one of those specialties that at the moment, I have no career aspirations to be a general practitioner myself, but that is actually partly the reason that it's one of the specialties that I would consider too difficult, too mentally straining for me to want to do day to day, because obviously as a specialist, you at least by the time you've been referred to, I guess, you know roughly which box the problem fits into, and your job is fix it rather than go down this whole mind map spider diagram of could it be this, could it be this, could it be this. And I have nothing but admiration for GPs on that front.
Yeah, I think you're right, and it's interesting that you've come to that conclusion actually, because I think a lot of people, even late into their career, they still see GP as being, this is just where you do sick notes and coughs and colds. That's the easy stuff. And I have a lot of admiration for specialists because, yeah, you're right. Once they arrive to you, often a specialist will if it's one of their, specialty conditions, it's quite straightforward for them to diagnose. And then the challenge becomes, how do you manage and treat this patient? What specialist surgical operation do you need to do, or what specialist treatment do you need to start and trial and follow up? But I think a lot of the thinking and figuring out where people should go, it happens in general practice. A lot of the diagnostics, trying to work out what's going on, happens in general practice, at least the first step of it. And it's interesting that you said about it can be too mentally taxing as a GP. I haven't met many medical students who have that opinion, or a lot of specialty doctors think that it's quite easy work. So it's quite curious that you've worked that out.
Well, I just all that stems from GP, because for those unacquainted, in medical school you tend to rotate around different specialties for a period of time, say 4, 5, 6 weeks at a time. So most virtually everyone will do a GP rotation or two. And GP, again, at the moment, I have no designs on becoming a GP, but GP has been my favourite block from medical school purely because I found it the most, it was the best clinical learning, because you just see so much and you're exposed to so much, but you also... The thing I became, I think, cognizant of quite quickly is that GPs are usually, I think, a personality profile of quite open, quite kind, quite caring. You don't meet many GPs with the surgeon mindset profile, if that makes sense. Most GPs are nice, well-meaning, well-rounded, very intelligent, very caring, very compassionate people. But those people also have the challenge of trying to fit good quality patient care and diagnostics into a 15-minute appointment. And I think that was the thing that I struggled to watch, I think, during my rotations, is they are by and large wonderful people with only the best intentions for patients, but are constrained by a system that doesn't really allow for it.
Yeah, I think 15 minutes would be... I'm on 10 minutes at the minute. I think most GPs in the Manchester area are on 10 minutes. But I think 15 minutes is probably necessary, especially with face-to-face appointments, by the time you get people in and get people out and then type up your notes and order the investigations and all the other stuff you have to do.
Yeah.
GPs are very good value for money. Yeah, we'll see. I would be very interested to see how things go with your career. I would definitely stay in touch and see where you end up.
I guess just for this this next part, Tom, we got sent loads of questions. So say virtually all of my colleagues at med school, certainly here at Warwick, are using your stuff for finals, because suddenly we're able to divert from Warwick's rather bizarre singular curriculum, and we have access to all of these amazing resources. So just to try and barrage you with some questions.
Sure.
Well, one of my colleagues has already said, what type of medicine do you practice? And when he's not working on 0 to finals, do you have a particular interest in an area of medicine?
Well, I think one of the reasons I became a GP was I'm interested in a lot of things. So I thought very hard about becoming a physician and an endocrinologist or some other type of medical doctor. And then I rotated onto pediatrics, and I thought, do you know what? I'm going to be a pediatrician. I love this. It's really good fun, and had a great time. And then rotated onto obs and gynae and thought, well, this is great. But to be honest with the obs and gynae, gynae was fine, but obstetrics scared the hell out of me. Obstetricians are serious heroes. It gets very crazy doing obstetrics, so I have so much respect for them, but I couldn't handle it myself, although I really enjoyed it and enjoyed doing that. And pretty much everything I do, I enjoy it, and I thought, well, how can I do a bit of everything? And that's where I ended up in general practice, and it's perfect for medical education as well, because of the things that I do in general practice, pretty much all of it is relevant to medical students, and everything that medical students need to know, almost, other than the acute stuff, doing IV fluids and cannulas and stuff, almost all of it I can teach, so it works out great. And I see my specialty as medical education, really. That's my real passion, and that's what I'm going to spend my career doing.
Professor of med ed somewhere, Professor Watchman. Is that the goal?
Well, it'll be cool. It'll be cool to be a professor, but I think going back to what we said about, this book being about teaching, my interest is more in teaching rather than furthering my career and becoming a professor and publishing lots of papers and being prestigious and renowned amongst my peers. I'm more interested in creating the most useful stuff, and I think that's why people like 0 to finals. It's for medical students, it's not for me or for my peers or to look clever or to become a professor or anything like that. It's just, this is the most useful stuff. So if I become a professor, that would be cool, but it's not really top of the list of priorities.
Perfect. And that was from Zoe, and she says, P.S. Thanks, Tom. You've saved me for finals revision. And this is a theme that has been explored a lot.
Thanks, Zoe. Good luck.
We have from Emma, why are you the best person on earth?
Well, that's an awkward question to answer. Maybe after this interview, you'll think, oh, he's not that great.
So some of the questions were, and I can't remember whether I've asked you this before or not, but someone has asked, do you have any plans to bring out an electronic copy of any of the books?
Well, they're all available as Kindle, so you can download them on the Kindle from Amazon. But all the books, I don't know if people realize this, but the entire content of all the books is available for free on the website at zerotofinals.com. And there's no Amazon, there's no advertising, there's no login screen or anything like that. The website is completely free. So I don't want to hide the content from anyone. It's all there for you for free, so no need to buy the books at all.
So it is the same stuff that is in the books that is on your website, is that?
Yeah, actually, the website is more up to date. So I'm sure anyone who uses the medicine book will be very familiar with the typos and the mistakes and the errors in there. And hopefully most of those are updated on the website. But yeah, so all the same.
Perfect. We have one that very encouragingly just says "help me," which I suppose in a good position to do as we approach finals. We have some other ones here, which is, what's your favourite biscuit? Why not?
I'm quite keen on cookies. So some people have called me the Cookie Monster. That you can get these shortbread chocolate chip cookies in Sainsbury's. I can finish off about 4 of those in a sitting.
Those are the ones.
But I try and stay away from them.
And the other one we have, is scone or scone?
Scone.
Correct. Moving on. I think there's just so much to go into. I mean, something we could touch on is, because it's quite refreshing and it's something that I don't get the chance to explore with people very often, and it's something that I've been very frustrated with myself, is that the career progression in medicine, the system and the culture to a certain extent expects you to be publishing papers and writing books with prestigious publishing houses and I don't know, lining bookshelves and extending your CV until it's as long as your arm. And it sounds like you've almost taken quite a counterculture approach, to, maybe there's a better phrase, but it's not common, I don't think. Have you ever received any pushback about what you do?
Any pushback?
Or any, maybe that's not the best word, but are any, when you explain it to people, do they get it? Do they understand?
Yeah, it's curious, really. I think this is an interesting one. The first thing that comes to mind is I'm dyslexic, and or I was diagnosed as being dyslexic when I was maybe, 8 years old or something. I haven't been tested since then. And I've more or less overcome it, really, I guess. But I had a consultant, obstetrician and gynecologist, who was dyslexic and banged on all the time about how people who are dyslexic think a bit differently and see things a bit differently and think outside the box. And I would say that's something I've always done. I've always kind of, I guess, looked at things without a certain amount of pressure from the norms, and just looked at things in the way that I look at them, and I think see things kind of clearly without, in a sense, without having to play by certain rules. And I think that's kind of maybe where Zero to Finals has come from, and where I've always had this thought of, why would you publish a paper that is purely just for your CV? Absolutely, publish a paper if you're interested in research, definitely. If you've got something you're passionate about, definitely do it. But for me, I was never interested in research and publishing papers. I was interested in academics, interested in learning things, interested in how things work, but never interested in like being purely academic and publishing papers just for the sake of sort of building up my CV. So to jump through those hoops just for the sake of it, for career progression, never really made much sense to me. I don't know if I've gone off on a bit of a tangent here, but yeah, I guess I do see things a little bit differently. And I would imagine that you probably see things a bit differently as well, having started a YouTube channel in medical school. It's not something that everybody's doing. And having watched some of your videos, and even just talking to you now, you seem to have thought things through to an extent that certainly I didn't when I was a medical student, and I think a lot of medical students don't. And a good example of that is when you were saying about being put off GP by the concerns about how taxing it would be. I think a lot of people wouldn't have, had that perspective to think things through that far at this stage, anyway.
I guess different things to different people, isn't it? Different priorities. Yeah,
that's true. That's true. But yeah, I think I do see things a bit differently.
But on the note of that, because that's that comment just about something with dyslexia, and this is something that I've been involved with a project recently, which has involved a lot of thinking about. I really dislike the term learning difficulties, learning differences, maybe. How we present and how we do our typography and typesetting and all of these different things to cater for people with things like dyslexia or ADHD and all of these things. Has that affected your job as a doctor in any way? Do you think it, I don't know, did it hamper you at all, do you feel? Did it give you advantages? You've already kind of said about your problem solving, but how about as a clinician?
Yeah, I think, to be honest, in terms of my dyslexia, I wouldn't say it's very significant. It was something I was diagnosed with when I was quite young, and then I had some extra help in terms of learning to read and things like that. And I would say that it's never held me back. I've never been tested again, and I don't have the extra time on exams and things like that. So if anything, it's mild, or it may even I may even have sort of overcome it really with time. So it's never really been too much of a problem for me, and I've, in a sense, I guess I'm lucky, and it's not really held me back at all. And if anything, it's mild, or it's kind of, I've grown out of it, if that's a thing. But I do think there's something about dyslexia that makes you think a bit differently. And certainly I've always had a very mathematical, logical mind, rather than, I don't know how you would say it, a language-based mind, or maybe being dyslexic, while I struggled to read and learn to read initially, somehow has sort of increased my ability to see things clearly, and that's given me the advantage in terms of explaining things when it comes to medical education.
Maybe we're looking at three books and the flashcards.
Yeah, I mean, to be honest, it hasn't really affected me as a doctor, I don't think, other than I mean, if you've read my books, the spelling is terrible, and I struggle to spell drug names and things like that. Amitriptyline, I probably write it several times a day, and I still can't spell it. But other than that, I'm okay.
It happens as long as you must prescribe it often enough. I guess the last thing to ask is then, what's the future for Zero to Finals? There's maybe secret, exciting things you can't tell us about, but do you have a broad strokes plan?
No, there's nothing super secret, and to be honest, I try and produce stuff as quick as possible. The interesting thing with Zero to Finals is I started it, let's say, in 2016. Was it 2016? Yeah, I think 2016, end of 2016. And for maybe 3 years, I got like 2 visitors a day to the website. Nobody used it. And then I think as the podcast came out, a few people started to trickle in. Then the book came out and it grew in popularity. And then it's been very exponential in terms of how many people are using it. And the problem I have now is that I can't produce things quick enough to satisfy people from all different directions. So I'll get people who will email me saying, I love your videos, please make more videos. And I desperately want to make more videos. And then I have people saying, please just knuckle down and get the surgical book done.
Where's
I need
the
surgery book for my final. Yeah. And then I get other people emailing saying, please get the audio book done for OBS and Gynae as quick as possible. And people saying, are you doing the flashcards for the pediatrics? I really need the peds flashcards. And I guess people may think there's a team behind Zero to Finals, but it's literally just me. I do the web design, the recording, the videos, editing, the illustrations, the writing, the book design, everything is just one person, plus running the business, trying to like sell stuff. So the only thing other people do is got a team, a company who prints the flashcards and ships them, and then my brother does the editing for the podcast on the audio. But everything else is me. So there's only so much I can do. But anyway, back to your question. Currently I'm working on the surgery book. So hopefully that will be out in a couple of months. Then followed by the OBS and Gynae audiobook, the surgery audiobook, the surgery flashcards, and really, and then after that, I have a plan for another book, which is at the moment just called More Topics, which is the final book in the 5-part. What's the 5-part equivalent of trilogy? I'm not sure.
Pentad or something, a pentology.
The pentology of Zero to Finals. And that More Topics book has got psychiatry, data interpretation, which I think is going to be really useful, pharmacology for finals, which I think will be really useful, and then a bunch of other stuff, dermatology and some palliative care and some other things that are really important. Then after that, maybe an OSCE book, maybe a book on how to learn medicine, which I've been thinking about for quite a while. And then more flashcards for each one of those topics. I need to build out the question bank.
I was going to say question bank. Yeah, that was something that a few people asked about. Any ideas on an MCQ bank or something?
Yeah, so there's some questions already on the Zero to Finals website, which you can go and have a try of. The problem is they were made in 2016, so they're very outdated, they're full of errors, and they're very basic. So I want to really create a solid question bank that covers everything you need for finals, and make it free on the website, so you're not having to sign up and pay lots of money towards it. But, it's a long list.
So much work.
Luckily, I get to spend 5 days a week doing this stuff. But if there were 20 days in a week, it still wouldn't be enough. But it'll keep me busy, and I love doing it, so it's going to keep coming out.
Well, hopefully it gets recognised for you. I mean, that's I think the takeaway that I'm getting from all this is that there are very, very few people, I think, in the world that are willing to not just put free stuff out there, and as you say, put the community and the stakeholders and the user base above their own personal career progression and development, and even fewer who are willing to grind away to produce something that is as good and as comprehensive as Zero to Finals. Because what I think the people watching this, I'm sure most of you get it, but what I would ask people to really appreciate is that if Tom wanted, he could very much lock all of this behind quite a substantial paywall, and people would buy it. Like, medicine and med-ed is such an industry that you already have a very anxious, fear-driven user base who will purchase resources if they feel that it's going to help them get through their exams, because that's who medical students are. Right? as I remember one of our med ed, I think she was a clinical fellow at the time, and she was very interested in what motivates students to study. That was her area of interest, and did this psychological screen on all of us in the first year. And it genuinely turned out that by and large, something like 90% of us were primarily driven by an anxiety of some sort, whether it was fear of failure or need to perform or something, which just speaks wonders about the medical selection system.
It's fascinating.
But yeah, people just, if you take nothing else away from this interview, please celebrate Tom for what he does and what he produces and how good it all is, and the fact that it's available for free, because that's incredibly rare. And I do hope that it does get recognised for you, moving forward, and keeps being celebrated for what it is, because it's spectacular. It really is.
Well, you're really too kind, to be honest. I think it's another curious thing about how I think I see things a bit differently. And what's interesting is, you're right, I'm sure I could make a lot of money by putting a paywall up and charging people, £100 for 6 months access to the content or something crazy like that. I could make a lot of money from it, but and a lot of people have kind of said, why aren't you charging for this? And they're very confused about why it's all free, especially why is the content of the books free? Why do you not want people to buy the books? And a curious thing is, I've never been too motivated by money, and I think that helps a lot. And I'm way more motivated by just knowing that people are using the resources. Every time I get an email from somebody saying you got me through finals, I used your book and I've read it several times, and used your videos, I really liked them. That for me feels like making £10,000 is really satisfying. And I kind of had this debate with myself a year or two ago, where I had this societal pressure of you've created this thing, you should be charging for it, you should be making money from this, or you should be making more money from this. And then I almost had this sense of joy when I realized that actually I could just work really hard for something I believed in and not care too much about the money. And it actually felt really good. I suddenly realized hold on, I actually don't have to try and make as much money as possible from this. I've got enough money to live and enough money to have the stuff that I want, which, to be honest, isn't very much. I spend most of my money on takeaways and food. Why not? But I'm not a too flashy person. So being able to just do what I love to and help people and actually get that feedback is all the recognition I need, and feels great, to be honest.
Well, what
if anybody's thinking about creating something just for the love of doing it and to help other people, do it, because it's really great.
Perfect. As I say, it's I think what a wonderful message to end on. Very, not only refreshing, I think, in the medical sphere, but just kind of life in general. What a rule, what a rule to live by. So thank you so much, Dr. Thomas Watchman, creator of Zero to Finals, for coming on today. Do you have any parting remarks for our wonderful viewership?
No. Well, thank you so much, future Dr. Ollie Burton, for having me on.
If your stuff gets me through finals, yes.
I'm sure you'll do very well. And good luck to everybody who sent in questions and is doing exams soon. I hope they go really well. I'm sure they will.
Lovely. Take care, Tom. Thank you so much.